Barry, sorry.
Good afternoon. My name is Barry Hudson, and I am the Director for Public Information for Montgomery County. And we'd like to thank you once again for joining us for the County Executive's weekly media briefing. Joining us today, we have a couple of special guests. We're joined by Councilmember Gabe Albornoz, who will be here to discuss a topic with the County Executive. We're also joined by Montgomery County Fire and Rescue Service Chief Scott Goldstein. In addition, we have our public health team who is here again, our public health officer, Dr. Keisha Davis, our acting director of Health and Human Services, Dr. James Bridgers. We're also joined by the Health Emergency Preparedness Manager, Sean O'Donnell, and as always, Dr. Earl Stoddard, who is the Assistant Chief Administrative Officer, who is one of the Chief Administrative Officers. I am going to remind you, reporters, if you do have questions, please put them in the chat. List your organization along with that, and we will get to your questions in turn. If you did not request, if you did request to get to record and that hasn't happened yet, please also put that in the chat and we'll try to take care of that. But without any further ado, I am going to hand it over to the County Executive to kick us off. Mr. County Executive.
So thank you all again for joining us. Last week was both heartbreaking and infuriating. As you know, we had a fire that resulted in a death and many people were displaced, and a horrible situation where Proud Boys protested at a bookstore. I want to update you on both these matters, but first let's start with another subject that's important to me. And the reason one of this week's guests is with us here today, because we appreciate Councilmember Albornoz taking the time to talk about intellectual and developmental disabilities. Let's address this first. As a parent of my own adult foster child with intellectual and developmental disabilities, or IDD as they call it, I know how difficult it can be to find and access services. Establishing an Intellectual and Developmental Disabilities Commission here in Montgomery County will help us identify the unique needs of people with IDD, foster dialogue, and improve information sharing with parents and with caregivers. And the commission will also help state and county government understand the needs of this special population. The state of Maryland has a commission like this, and I think we should too. So I greatly appreciate the partnership with Councilmember Gabe Albornoz to bring this proposal forward as a welcome addition to Montgomery County. Councilmember Albornoz is here to talk about this now and to answer questions about the program. So I'll stop talking and turn it over to Gabe.
Well, thank you very much, Mr. County Executive. I know you have a lot to get to in today's press conference, and I do very much want to thank you and your team for your partnership on the introduction of this important piece of legislation that has the full support, the unanimous support of co-sponsorship of the entire County Council. As you acknowledged very correctly, our IDD community is extraordinary, and more than 40,000 persons of all ages have an intellectual or developmental disability here in our community and require a unique set of support services that we provide here in Montgomery County, and that is also provided at the state level and also through a number of outstanding community-based organizations. Over a number of years, I have had the opportunity to get to know the families and a number of the extraordinary community advocates, many of which make up part of the Commission for People with Disabilities and have been advocating for these issues now for generations. But the complexities of the challenges that these families and these individuals face demands that there be a commission dedicated to focusing on those issues to help collaborate both at the local level, but also at the state level to ensure that there is stronger advocacy, to ensure that there is stronger communication, and to ensure that we are more proactive in addressing the challenges facing these families as opposed to being reactive. I want to thank the Commission for People with Disabilities for their support, and I also want to acknowledge the incredible work of our Department of Health and Human Services that they continue to provide in support for these families, and thank them for their support of this important transition as well. So we expect this group to make a series of recommendations, both from a policy standpoint, but probably a funding standpoint as well. And having a group focused on these issues will really benefit the entire community.
So any questions about the IDD from the reporters?
As we say, going once, going twice, 3 times. Thank you, council member, for joining us.
Thank you, everybody.
Thank you.
All right, back to you, Mr. County Executive.
So I want to turn my attention now to the deadly apartment fire in Silver Spring. I want to thank all the county departments, the Red Cross of the National Capital and the Greater Chesapeake region, and the owners of the Arrive Apartments for their work since the fire early Saturday morning in getting victims temporary shelter, food, and other essentials. And a special thanks to the DoubleTree Hotel, which is located just across the street from the complex. They helped provide a lobby and a space for victims who were out in the cold to gather during the day. They shared, had a breakfast for them and allowed our partners to use the conference rooms to help victims. Sadly, the fire killed one young woman in her 20s. She tried escaping the fire, which was several floors below her, but she was killed by the smoke that was apparently, had reached the upper floors and through the stairwells. Her death and the injuries of more than 24 people, bring up questions about safety in high-rise buildings. We're not unfamiliar with this discussion, and we're looking into what we could do to reduce fire and smoke risks. We know that the state is pushing for changes to building codes that require sprinklers in buildings like this, but they're looking at 2033 as an implementation deadline. And I get that, because this is going to be extraordinarily expensive to put sprinklers in all these buildings. And one of the fears that everybody has is it would definitely impact rents, and it could impact rents so severely that a lot of people who are barely affording what they have today will not be able to afford the rent increases. The property owners don't have the capital to do this on their own, and we don't have available right now any state or federal support to help with this transition. So we're hoping that we can find a way to provide additional funds to make this easier for the owners of buildings to undertake, and so that we could do this in a way that it doesn't severely impact rents and lead to more displacements. It's really important that we do find a way to balance this and minimize the impact on people. I don't want to wait 10 years to enact changes that could save lives in Montgomery County. We just have to make sure we can come up with a solution to manage the costs so we don't displace people in the process. I'm going to turn it over to Chief Goldstein and Dr. Stoddard to provide any updates or comments on the response and support efforts for the community. So Chief and Earl, feel free to take it over.
You can go ahead first, Chief Goldstein.
No worries. Thanks, Earl. As the county executive said, the thoughts for the displaced, the thoughts for the injured, and for the family of the young victim killed in this fire from the men and women of MCFRS go out in such a tragic activity. The opportunities to use this form and messaging through our media partners to outline the steps that can be done to help people be safe in their apartments today, sprinklered or unsprinklered. It really starts out and drives around having a plan. When we send our kids to school, our school organizations, our teachers, they drive in fire escape plans. They do that as a part of their safety organization in the school, and that needs to convey to your home unit as well. You need to have that plan. You need to practice that plan. And each and every step of those fire safety plans are driven around understanding that smoke is the #1 killer in a fire, being incredibly hot and filled with toxic gases and spreading throughout structures. That is the #1 issue for somebody to be aware of. And understand that when you hear that fire alarm, always evacuate early. If you hear that alarm, if you smell smoke, evacuate, contact 911 as you're evacuating, pull the pull station to set off the inside the building alarm system. Never use elevators, always use the stairs, and always have that second way out. Because an event like this has outlined the smoke traveled throughout the building. Some of these stair towers and stairwells were filled with this toxic smoke. And having a second way out, a different stair to use as an example, could be the difference between getting out safely or having to shelter in place. And that's what occurred here for some of our folks who were impacted by this event. Their hallways were compromised. They were told by the great folks at the 911 center to shelter in place. And that's close the door, close as many doors to put as many door barriers between yourself and the smoke in the hallway. If there's a balcony, go out on the balcony. If not, stay near the window. Call 911 and report your location. There's a lot that you can do as a resident to help yourself be prepared for an event like this, and there needs to be a plan. The circumstances, the 17 residents in that building who were injured on the early Saturday morning, some of which transported themselves to local hospitals, some of which were transported, the majority of which were transported by Montgomery County and Prince George's County EMS crews, were the ones that were impacted, and the 3 firefighters injured that day as well. So a lot that you, the resident, as well as we as the community, have already shared and continue to share. And when a building association or a community group has questions, reach out to us. We have educators, we have our personnel that'll come out, provide that information with you, show you how and what is needed, and help you in that process. So I pass off to Earl on more information about Saturday, but feel free to ask questions.
As of last night, there were still 64 units that were displaced according to the property management company, including all 32 units on the 7th floor. Displacements will range from, some properties potentially getting them back today, all the way up to some properties on the 7th floor, particularly, that will be out for several months. But all the units beyond, excluding the 7th floor, should be back in within a couple weeks. And so obviously the 7th floor is the most extensive repairs. The Arise Properties and Trinity Management Company, who operates them, have looked for other spaces around the area to place people, and many people, particularly on the 7th floor, are going to be displaced for months, have actually availed themselves of opportunities in other properties. As we discussed, Montgomery Housing Partnership has set up the donations link, and we encourage people to donate to that. That will go to benefit all 89 properties that were displaced for some period of time or another. But ultimately, there's a scheme that is worked out with our nonprofit partners where the people who are most impacted or will be displaced for the longest period of times get the benefit of those resources preferentially. Next week, we're going to be hosting a disaster assistance center. We're actually looking for a location. So once we have the location, we'll be able to confirm the date and time of that. But the disaster assistance centers, based on previous events, are basically resource fairs, involving not just county resources, but also our nonprofit partners. There's actually a nonprofit coordination call that's starting in approximately 12 minutes with our emergency management and health and human services partners. So they're really aiming to try and coordinate well with the with the entities in the nonprofit and county space to make sure that that goes well. So as of text message I am getting right now, the MHP fund is at $23,000 already. So we appreciate very much and always do respect the generosity of our residents. I also would be remiss if I, along with county executive, didn't credit the DoubleTree for their extraordinary efforts here. They did step up at a time when they didn't have to. They gave space to displaced residents. They actually provided a cooked meal for them that morning, and they went well beyond what they need to do. So we very much appreciate the efforts. I also would recognize Councilmember Stewart and Delegate Lori Tricunian, who spent much of their days on Saturday at the site. They did everything that was asked of them. They were often in interface with residents, and we very much appreciate their coordination and collaboration around. They became a conduit for us to receive information from different parts of those affected, and we've been able to quickly act on those needs or gaps or communication issues. And so we very much appreciate collaborating across branches of government with them. So I'll stop there and I think we can proceed.
Thank you, Dr. Stoddard. We're going to keep going with the county executive's update, and we'll come back to questions on the fire when we get after the public health piece. So, county executive, I'll hand that over to you.
Okay, thank you. So for the second time in the last 4 months, we saw a group of Proud Boys try to stop a drag queen story hour event. The latest disruption happened Saturday morning outside a bookstore in Silver Spring. Volunteers formed a wall outside Loyalty Bookstore, preventing demonstrators from entering, leading to some shoving, hitting, and kicking. This episode was upsetting for several reasons, including the abhorrent messaging protesters were trying to deliver, the violence they were willing to use, and how it appears these incidents are escalating. I don't want to see violence coming from these, and we're looking for ways to protect people from the threat of violence posed by these protesters. The demonstrators shouldn't be allowed to use force without consequences, and I expect assaults to lead to arrests, period. If they try to repeat some of the things we saw captured on video this past Saturday, then I expect those people will be cited, arrested, and jailed. We still protect anyone's right to peacefully protest, but that's not what's happened over the weekend. In other news, Montgomery County and the Fraternal Order of Police Lodge 35 have come to an agreement to begin offering a $20,000 bonus for new sworn police recruits. It's a unique opportunity to not only reward new officers, but also to recruit some of the best officers in our area and have them work in the county they call home. Funding for the initial part of this effort will come from savings accrued from the large number of personnel vacancies within the police department right now. And full implementation of the bonus program will require council approval for the FY24 year and beyond budgets. Chief Marcus Jones confirmed earlier this month in testimony before the Public Safety Committee that the department is currently down 129 sworn officers. That's a large number to make up, but when this bonus is paired along with other pay increases for officers approved in this year's budget, we're hoping that it will help us make up the shortfall. The other thing we're dealing with is the number of officers that we know are going to be leaving over the next 2 years exceeds the current planned classes. And we would need to be able to attract more officers to increase the size of our classes and the number of people in the classes in order to avoid having this number of vacancies go up. Right now, we're working with the police on many reforms, as we know, including revamping of our training procedures. The 2-year study by a nationally recognized consulting company focused on public safety, and it's helped us identify ways to improve how our officers interact with the public and how they're trained. Our department has high expectations. Our community has high expectations, and I believe this bonus money will help attract some of the best candidates. And we want more of our police officers to come from Montgomery County. And if we can help them afford to live here, that will also help us grow an already, effective department. The next Public Safety Training Academy for new officers is slated to start this June. Concern about teen drug use and overdoses is resulting in another community forum on the dangers of fentanyl. It will be happening this Saturday at Northwood High School in Silver Spring, and it starts at 9:30 a.m. Fentanyl is a synthetic opioid, and it can be deadly even for first-time users. since the start of school year. 5 deaths have been blamed on fentanyl use, and many more have needed emergency anti-overdose medication, which we know commonly as Narcan. Some breakout sessions during the 2-hour program will be conducted in Spanish. The number of deaths, had we not had Narcan, would be multiples of the 5 who've already died. Just last night, Spanish speakers were brought together for a similar community forum that was held online and entirely in Spanish. And community members called for the Spanish-only presentation after the first community forum late last month at Clarksburg High School. We hope that no matter what language is used, the message is clear. No one is immune to the dangers of fentanyl. And speaking of the dangers of fentanyl, national settlements against drug makers and distributors over opioid lawsuits are expected to bring Montgomery County approximately $34 million over the next 18 years. That's a pathetically small amount, given the amount of damage these people have done to the community. The same suits are expected to net the state of Maryland another $400 million over the same time. Monies are from settlements against pharmaceutical companies that the county joined in 2018. And quite frankly, despite the large monetary amounts, it's still not enough restitution for what these companies did through communities throughout our nation. If anyone else in society went out and committed an act that led to thousands of deaths, they'd be facing life in prison at the very least, not fines that are corporate fines. It's frustrating that people who've masterminded the explosion of these drugs have completely escaped responsibility for their crimes. And yet it's another example of the unequal treatment under the law for white-collar criminals, even when they commit murder. It continues to astound me that you could get away with this, that they're actually getting away with this, and they don't face the kind of personal consequences that other people who kill people would be expected to face. It's not a good look, and it's certainly not fair. And the fact that they're paying money in no way exonerates them from the tragedies they've created. Additionally, Montgomery County is filing another lawsuit, another multi-district lawsuit against McKinsey and Company, another culprit for its role in marketing opioids to the public and medical providers. County Council recently approved the law firm to represent the county in this matter. The suit alleges that McKinsey defendants served as marketing advisors to several opioid manufacturers, and that in that role, they helped to counter the quote unquote emotional message from the families of overdose victims and advised Purdue on how to quote turbocharge the sale of opioids. So here's an example. When pharmacy chains like CVS and pharmaceutical giants like Anthem started worrying about the staggering number of opioid overdoses and deaths that were attributed to OxyContin, pharmacies were knowingly filling prescriptions for customers flagged as probable opioid abusers. And I'm sure you've read the stories about towns that were flooded with so many opioids. It was more doses than the entire town could consume. The consultants at McKinsey were tasked by Purdue to figure out how to keep sales up and keep pharmacies from following restrictive dosing protocols that would have pushed sales down. McKinsey came back with a solution to the opioid crisis. That is, if you define the crisis as the risk to Purdue's profits. To counter CVS's worry about liability and the ethics of killing their customers with Oxy, they proposed issuing pharmacies rebates for each customer who overdosed or died of opioids. What did these consultants decide a human life was worth, and how much would it cost for pharmacists to throw their morals out the window? The price was about $14,000 per overdose. $14,000. Something fundamentally wrong here. And if you're not disgusted, I don't know what would disgust you. For over a decade, McKinsey provided guidance, consulting, and marketing plans like this. I'm glad these legal efforts are moving forward. I anticipate the money awarded to Montgomery County will help address the ramifications of flooding our communities with highly addictive drugs. And these companies made billions of dollars while families suffered the consequences of drug addiction. They must be held accountable. And hopefully at some point, point more accountable than just paying a fine. On the health update this week, we had another big drop in COVID-19 cases, and we're seeing new hospitalization numbers fall to levels we haven't seen in more than a year. Our community level now is remaining low, and we remain committed to providing vaccines and boosters to walk-in patients or by appointment for anyone seeking one. You can schedule these appointments online or by calling 240-777-2982, or by scheduling a visit with your local doctor or pharmacy. Staying up to date on your bivalent boosters is still your best protection for a serious bout of COVID, and most people who have received their booster shot since September have not been seriously ill. COVID testing kits and face masks remain free and available at local libraries and other county facilities. And with all that said, I'm going to turn this over to Sean O'Donnell for this week's health report before we take your questions.
Thank you, Mr. County Executive. As the county executive said, this is a good news report this week. We're seeing, in addition to the decreases in transmissions with PCR testing, we're seeing some of our lowest totals in months for emergency department visits overall. So it's a good sign for the resources at our acute care centers. Looking at the entire range of respiratory disease that individuals are showing up at hospitals with, we see those rates are decreased across all of our ages. So again, we are looking to have come out of the respiratory disease season. We're on the downside of that. Here's the visualization for hospitalizations. We're now down to 93 total patients across our acute care centers and our alternate care site with a COVID diagnosis. Nationally, you can see this is the mortality surveillance across the nation for respiratory illnesses causing deaths. And you can see with the red line there that across the nation that these have been receding over the last few weeks. They're still, again, higher than what we would traditionally expect pre-COVID. And much of the country, again, is having decreased flu infections. And we are seeing our surveillance in the state of Maryland. That's the red line for this year. Those have come down to a much lower rate of respiratory percentage of illnesses that are respiratory illnesses. To date, across the state of Maryland, we've had 60 reported influenza deaths this season. And I just wanted to highlight, as our county executive said, we're still offering services across the county. We are doing vaccinations and PCR testing at a range of locations. I highly encourage individuals to go to our website to get the details on where we are. This is just a few of the sites. Our partners in our health initiative clinics, they're doing many, many more sites as well. And the vaccinations, the COVID boosters, those shots are free. The PCR testing we're offering is free. And we are continuing at 19 of our libraries to distribute free rapid tests and masks. And we have those test yourself PCR tests at a handful of our recreation centers. So again, we have lots of opportunities for our county residents to get that booster shot if they haven't. There's only been one booster shot recommended this year since September. And if you haven't gotten it, we strongly encourage you to get it. At this time, I'd like to see if there's any additional messages from our director, Dr. Bridgers, or our health officer, Dr. Davis.
Thank you, Mr. O'Donnell. No additional comments from me at this time. I'll turn it over to Dr. Davis.
No, thank you, Mr. O'Donnell. Very well done. Nothing else additional.
Okay, thank you all for your input. Reporters, we are opening the floor up for you all to ask your questions. Remember, please drop them in the chat and list your news organization. We are starting off with one question already from Steve from MoCo 360. Go ahead, Steve.
Afternoon, everyone. Just a few questions about the $20,000 police bonus. Just a simple question. I know Anne Arundel has offered that amount. Is that kind of what went into the thinking of offering a bonus of that high? And I guess Mark or Dr. Stoddard could feel just kind of how the county reached that number, I guess.
Pretty much what you said. This is what we're in competition with. And, it's not that far to drive, for a decent job. And, we know that they've been successful, anecdotally in terms of bringing more people in to sign up for classes. We can't afford to lose out on recruits and have them going somewhere else.
And I guess this, obviously recruitment, using higher salaries is part of the equation, but how confident is the county in terms of filling the vacancies, in terms of just the environment of being a police officer right now, and kind of that aspect of this issue, if that makes sense?
I mean, there's the broader environment, and we're not going to be able to do anything about the broader environment. I've said this before, every time somebody does something somewhere, it winds up, reflecting on the entire police forces of every police force in the country, regardless of whether they're a good police force or they're a bad police force. And so, the people who act out, they have negative consequences for everybody. And that makes recruiting a lot harder, because if somebody feels like they're not doing things that are wrong, to be tarred with a brush that, is painted broadly on everyone, that's a problem. We've worked to make changes in our police department. We know there are things we can do better. I think what came out of ELE 4A, if anything, was the importance of training and the importance of training our officers differently than we had before. And I think that'll make for a better department. That'll make it better for the officers and make it better for the community. So I think we're going down a decent path here. We've been able to do a lot of this stuff without, heavy resistance from our police department here. So that's a good sign. And hopefully we can maintain that. And at the end of the day, when an officer is evaluating where they're going to go work, no one should be surprised that pay wouldn't factor into that decision. And when you're talking about $20,000 versus no dollars, even if your annual pay is close, $20,000 is pretty compelling. So we think it will help us, plug the gap in the long term. Our short-term problem, of course, is that the number of planned resignations over the next 2 years exceeds our current, the size of our current classes, which means the big thing is we're hoping is that we get enough new recruits that we can bring in enough additional officers into trainings that'll offset the number that are retiring. And that in itself would be a big lift and just keep us where we are today for the moment. So we've got a lot of work to do, but we're committed to doing it.
Thank you.
Okay, thank you, Steve. Next question is from Kevin Lewis. Good to see you, Kevin.
Hey, hope everyone's having a good day. County Executive, on the police signing bonus, how did you and others come and settle on the $20,000 figure?
Because Anne Arundel kind of set the market. And, we know that we're competitive. They have a lot of similarities with us. And there's no point in putting out a bonus that people would say, that's nice, but I can get more in Anne Arundel County. And DC's got bonuses now too. I forget what theirs were. But we don't operate in a vacuum. And this is certainly one example of where we don't operate in a vacuum.
DC also does 20. I believe Howard does 10. Baltimore County does 10. And so, obviously with the district doing 20 as well, it was a sort of a natural, be competitive. That's what we want to get. And when we saw that, as the county executive alluded to, Anne Arundel actually overfilled their class this year. And so when you see that, it makes some sense to do what people who are being successful are doing.
We need to overfill our classes, Kevin. We're not going to solve this problem if all we do is fill what we expected. which was aspirational. It wasn't like a goal. We set the number at what we hoped we would get. We need to get more. So we need a policy that's more likely to bring people here.
And I seem to recall the budgeted number for the police department is somewhere like 1281. Is that still the budgeted number, and working off that 129 deficit? Are those numbers accurate?
I can't swear to you that all those are patrol officers. Obviously, we're emphasizing patrol officers here, but the vacancies are real at 129, and they will go up.
And from your conversations with the police department, when we're talking about 129 officers, what type of like real day-to-day impacts does it have? I received an email from a resident a week ago who had an abandoned car on their street, and they called the department, and the impound lot said, we're basically swamped just with the impound lot. We can't go out and tow vehicles at this time or deal with that. I don't know if that's accurate or not. That was what was just emailed to me. But just to kind of put this into context, into real people issues, real department issues, what would these extra 129 officers bring to the department?
So it would help them fill shifts. It would reduce overtime, which overtime puts more stress on officers, and you don't want to be filling shifts constantly with overtime. It would help us avoid the pulling of some officers from nearby, other stations. Because, for example, in dealing with Silver Spring, you couldn't deal with that with the number of officers that are available just in the Silver Spring contingent. So we're in a position where we're pulling people from other places to help fill this. And of course, that creates a hole someplace else. There's no free ride when you start moving people around. So it has consequences. And I know the chiefs talked about, pulling people off of non-patrol duties to put them into the front lines to help with some of this. So we're doing what we can do to try to get as many folks on the street as possible, and do it in a way, hopefully, that minimizes creating deficits in other parts of the county.
The one thing I will add to, Kevin, is one of the big things, and county executive alluded to this, we want to train officers better. In order to train people, you need to pull them off the front lines and actually train them, which is increasingly difficult to do when you have reduced staffing and you are struggling to make, get the frontline staffing, because that's the key thing that residents see. We know we need to do more training, and so we need to have a greater pool of officers so we have a frontline staff and an ability to do training on the back end.
Yeah, that's a good point. I appreciate you mentioning that. And then the $20,000 signing bonus would be given to up to 129 officers to come to full staffing, and then that offer ceases to exist.
Yeah, I can allude to this. So it's viewed as a pilot. So obviously we're going to view it, we'll continue to work with the Patrol Police. I will say, having been a part of many of these budget conversations, we know we have 129 vacancies now, but we also know that there's probably some growth in certain areas that we probably also have to think about too. We've had this conversation around, what a 7th district will look like. We're going to start to really plan that out. And so I don't know that it would stop after 129, but that would be based on conversations both with the Fraternal Police and also with County Council around the budget process. So I think we know we have 129 vacancies now, but we haven't intentionally added positions because we know we couldn't fill them because we already have vacancies. And so I do think that there is probably a further conversation that would be had as we get close to that 129 about, what is the right sizing of the department for the future.
All right. Thank you very much for those details. I appreciate it.
Thank you.
Next question is from Heather Curtis from WMAL.
Hi, everyone. Thanks so much for being here today. My first question is for Chief Goldstein. Wondering, I was reading something that I think 7 News had reported that soon buildings are going to have to post signs if they don't have sprinkler systems. I'm wondering when that may be able to occur, and is it at all possible for residents who own their units to install their own sprinkler systems, or would that be, prohibitively expensive or too difficult because of the pipes, et cetera?
So I'll take those two parts naturally separate. I am not aware of any signs related to hosting of the building's protection systems or protections levels. I'll take that as a note, and we'll see what Department of Permitting Services is aware of or knows about that. Second component to residents' self action or residents' self ability to apply sprinkler systems. In broad sense, yes, it is extraordinarily complex and challenging for a resident to do that. There are systems out on the market that are portable. They're predominantly designed to support temporary mobility challenges. I'm going to say somebody who's recovering from a surgery or recovering from or bedridden for a certain period of time. It's almost like a portable humidifier or a portable tank system that is plug into the wall, provides a water reservoir, and then a sprinkler head. And those systems are out there. It's one that would only limit the protection to a single room, not the multi-room apartments, and or does not provide protection in general common areas. Those products are out there and are very effective in how sprinkler technology has changed in the recent years.
Thank you so much, Chief. And I'm wondering, for Mr. Elrich, you talked about, Kevin was asking about how the shortage of officers impacts daily operations. Are you seeing any impact in response times to incidents since there are 129 fewer officers than you need?
I have not seen the chart that shows a change in response time, but I can't imagine that it doesn't have some effect sometimes. I would be naive if I thought they could respond this quickly with those numbers of shorts. But I haven't seen anything where they, at least they haven't come and said, we have an alarming increase in response time yet. I don't know if Earl has anything.
Yeah, so what you see, Heather, is the priority calls are responded to as a priority, and they get, obviously, that those are the things we track the closest. But what you will see is, I did a ride along, I think 2 weekends ago, and there were calls that were held, meaning that we'll respond to them after we respond to the priority calls, essentially. And so, for example, I think there was maybe there's someone hit my car and is no longer on scene. I need you to come take a report. That type of call might be held for 45 minutes or an hour while officers respond to it because they're prioritizing responses that are real-time life safety related issues. So that's an example of what you've seen. We've tried to compensate for some things by they've added a telephone reporting unit. So, for example, if you just need a police report for let's say you're a business who's had someone shoplift and that person has fled the scene, and you just need to file a report so your insurance company can respond. We actually have a telephone reporting unit that allows you to do that over the phone, and they can send you the police report directly, which saves officers time. It allows us to offset some of those things. And so there are changes that have been made operationally to account for the fact that we are short on officers. But the priority calls, you would not see a reduction in call response, like officers rushing lights and sirens to a scene, because those calls are prioritized over other calls that are maybe property damage or property theft like related calls.
Sure, fair enough. And County Executive, I have one more question. I see that Councilmember Glass wrote you a letter asking to create an anti-hate task force. Obviously, you've been, even today, speaking out against the hatred against being directed towards all sorts of people in our county and around the country. Is that something you would be amenable to? And do you feel something like that could help?
Yeah, we've been talking about this. We've had numerous conversations with folks in the faith community and other groups that have had to put up with this. And I think it would be helpful for people to talk. I do understand the concern, and we do have to figure out how we get more people involved in the effort to push back against hate. We have uneven participation, I would say, in terms of people who are involved in helping us push back against these kind of acts in the community.
Thank you so much, gentlemen.
Thank you.
Okay, I don't see any more questions in the chat. I'm going to open it up to see if there are any more questions. Going once, going twice, going 3 times. Thank you very much for joining us here today on behalf of the county executive. We'll see you next week. And if you have any other questions for us, you can certainly reach out to our PIO team for any additional follow-up questions. Thanks so much and have a great rest of the day.